Do you know how many lives could be saved every year if ordinary people like you and I knew the symptoms of a heart attack? Wait a minute. Do you know the symptoms of a heart attack? Suppose an ordinary person is sitting at home and just reading a book. Everything looks good, doesn't it? Suddenly it becomes difficult to breathe, or you sweat a lot and you feel a lot of pain in the chest, and by this time, it is too late and heart attack comes to that person. But did you know that there are signs that you can identify a heart attack before it happens? And if you see these signs, you should see a doctor as soon as possible. When blood flow to a portion of the heart muscle is interrupted, a heart attack happens. The buildup of plaque in the walls of the coronary arteries that supply blood to the heart, which can be brought on by fat and cholesterol, is typically the reason for this obstruction. In this video, we look at the symptoms of a heart attack up to a month before it occurs. Also, keep in mind that these factors may show up to a month or even a few hours before heart attack. Chest discomfort. Feeling pressure or heaviness in the center or left side of the chest can be a sign of a heart attack. This sensation may feel as if a heavy object is placed on the chest. Some people may experience a burning sensation or sharp pain. This pain can resemble heartburn but usually does not get relieved with antacids. A feeling of constriction or tightness might also be experienced, making the individual feel like their chest is tightening. This pain may occur continuously or intermittently. Although short-term pains might be attributed to other causes, discomfort lasting more than a few minutes or recurring intermittently should be taken seriously. If the pain does not subside with rest or a change in body position, the likelihood of it being a heart attack increases. There are differences between chest pain caused by a heart attack and other types of chest pain. One such difference is that chest pain-related heart attack also causes breathing difficulties and does not improve with massage or different movements, which increases the likelihood of a heart attack. Unusual sweating. This type of sweating can be a sign of a heart attack and is usually not related to physical activity or the ambient temperature. It typically appears suddenly and intensely, even when the person is resting or in a cool environment. This sweating can become so severe that it soaks through clothes. Unusual sweating in this case is often cold sweat. Cold sweat is different from sweating caused by heat or physical activity and is often accompanied by a feeling of cold and chills. The person may feel that their skin is cold and clammy, even if the surroundings are warm. This condition can last from a few minutes to several hours and usually does not subside with a change in body position or reduction in physical activity. It may recur at different times, especially during daily activities or even while at rest. Shortness of breath. As mentioned regarding chest pain, shortness of breath is also related and can make identifying a heart attack easier. In this situation, the person may feel unable to take a full breath or may be forced to breathe quickly and shallowly, feeling an increasing need for oxygen with each breath. Like other symptoms, shortness of breath can come on suddenly and may worsen over time. Physical exertion and heavy activity can make this condition even more difficult. One of the main causes of shortness of breath during a heart attack is reduced blood flow to the heart. When coronary arteries become blocked, the heart cannot pump enough blood to other organs, including the lungs. This reduced blood flow can lead to heart failure, where the heart cannot effectively pump blood, causing fluid to accumulate in the lungs. In this condition, shortness of breath is often accompanied by sudden, cold sweating, which helps in recognizing a heart attack. It is important to know that all these related symptoms can appear up to a month before a heart attack, may subside, and then reappear. Unusual fatigue. This situation also exists in stroke. Fatigue typically appears distinctly and differently from ordinary fatigue caused by daily activities or lack of sleep. It is a profound and persistent sense of exhaustion that does not align with the individual's daily activities or amount of sleep and clearly impacts their ability to perform routine tasks. This condition often lacks an obvious cause and may gradually worsen over time. The feeling of fatigue may persist for several weeks or even a month, progressively becoming more severe. An individual experiencing unusual fatigue may feel that their body has significantly weakened and that they are unable to carry out normal activities. This incapacity can be such that even simple daily tasks seem challenging. This weakness and inability may manifest as a heavy feeling in the muscles, reduced physical strength, or difficulty concentrating. Sleep disorders. Sleep disorders can manifest in various ways. Some of these disorders include difficulty falling asleep, frequent awakenings throughout the night, and an inability to continue sleeping after waking up. These issues may occur regularly and persistently, leading to reduced sleep quality and causing problems with the individual's daily functioning. In this case, the normal and restful nighttime sleep essential for replenishing and energizing the body may be significantly impacted. Dizziness or lightheadedness. A person may feel as if their surroundings are moving or spinning irregularly, even though they are actually still. This sensation can occur continuously or intermittently, and its intensity can range from mild to severe. In some cases, the individual may feel as though the ground beneath them is shifting or may experience a sense of lightness and instability in their head, which can lead to difficulty standing or moving properly. If dizziness or lightheadedness persists or is severe, it is essential for the person to see a doctor as soon as possible. Now it's time to introduce things that increase the risk of heart attack. Smoking. When you smoke, a large amount of nicotine enters your blood, and nicotine narrows the blood vessels, which leads to an increase in blood pressure. High blood pressure can damage the walls of the arteries and increase the risk of the formation of fatty plaques. High blood pressure. High blood pressure is one of the main risk factors for heart attack. This can damage the walls of the arteries and cause the accumulation of plaques. Obesity. Obesity can put extra strain on the heart, leading to problems like heart failure. The heart has to work harder to pump blood to different parts of the body. Excessive consumption of alcohol. Alcohol can increase blood pressure and also increase body fat, which leads to obesity. This drink alone can cause clots in the blood, which block blood flow and cause a heart attack. We also have a video about the symptoms of a stroke 1 month before it happens. Check it out too. I hope you enjoyed it. Don't forget to like and subscribe, and stay healthy until the next video.